Hey guys, Erica Lee, Elite Massage Therapy. I'm a PTA licensed massage therapist and also a certified strength and conditioning specialist. In this video, I want to take a look at the hip. So if you're having any hip pain, we're going to go over how to treat that specifically. And also, if you're coming in from the knee or the plantar fasciitis video, we're going to go over why the hip is so critical in looking at when you're trying to also maybe correct those issues. All right, so let's take a look. Okay, so as I talked about, the hip plays a crucial role in the whole chain down the leg. So what we're looking at the hip is the glutes, specifically the piriformis and glute medius, as well as the adductor muscles that come through the inside of the leg here and attach down at the knee. So if you're having any knee issues and you have hip instability or tightness or weakness, what's going to happen at the knee is you're going to see a little bit of a valgus or a knock-kneed position. So as you can see in that position, it also collapses the arch of the foot, putting undue stress on the inside of the ankle, right? So it all begins at the hip. The primary role of the glute is to keep us stabilized and in an externally rotated position of the femur. So we want to make sure that we're strengthening the glutes, keeping those muscles nice and stretched out to avoid any pain or impingement in the glute area and also avoid any stress on the inner knee and inner ankle so we can prevent some issues down there as well. So when we're talking about bursitis or maybe piriformis syndrome, you end up with some radicular pain or numbness and tingling or just a little bit of discomfort down the side of the leg, okay? So what we're looking at there specifically is tightness of the piriformis and the glute medius muscle. So these few foam roll exercises, what I'm going to show you here right now, is going to help get into those muscles. This is going to be much more focused just directly on the hip, even though if you want to do some foam rolling down towards the knee as well, it could be very beneficial for you. You can adjust the amount of pressure you're putting through the foam roll by how much you sit on it or maybe lift a leg up. But keeping a leg down will help you not put as much maybe pressure through that area. So this is going to be nice and slow, gentle rocking, specifically just through the glutes, almost directly on that hip bone. Maybe if you've got bursitis, that's generally where you have most of the inflammation at, is the attachment sites of where the glutes and the piriformis connect at. So nice and slow. Again, taking your time through any areas of dis-ease, pausing, allowing that to relax a little bit before you continue. You want to stay here for about 2 to 3 minutes or so before going on to the next one. This next foam roll, you're going to do very similar, only this time, if you're able, place your foot on top of your opposite knee. This is then going to open up the hip nice and wide so you can get a little bit deeper right onto that piriformis. The piriformis is more of a muscle towards the sacrum. It's a triangular shaped muscle that goes pretty much from your sacrum over down to your hip bone that you feel sticking out there. So this is going to better get into that tissue when you've got your knee, your foot up, your knee a little bit pulled up towards your chest. And again, taking your time, gently rocking in this position, taking the time to pause over those areas where you're having a little bit more discomfort. Directly get into that tissue, really get onto a specific maybe trigger spot that you have and allow the tissue a little bit of a deeper pressure into it. So all you're gonna do, lean to your side so you're able to tuck the ball underneath you and then roll onto the ball to your tolerance. And you can reposition it so it's either closer in towards the sacrum or further out towards your hip bone. I've got some pretty hot spots in there. But yeah, again, take your time, stay on the ball for again 2 to 3 minutes to allow that tissue to unwind for you. So let's take a look at those adductors now. Now the adductors, the hip adductor muscles are a group of muscles that run from the inner knee up into the groin. Some of them come across and attach at the opposite side of the hip. So we have to make sure that we address these muscles in through the inner thigh as well, so that we have better mobility in the hip and less stress through the knee, through the MCL, through the medial meniscus. So we want to make sure we address this group of muscles as well. We're going to take, again, our foam roll. Start with it kind of just below the knee joint. You're going to turn further onto your stomach, this direction, and allow yourself to just roll the foam here in and out. Again, we're looking for maybe a hot spot, maybe an area of significant disease. I've got a few in there, and we're gonna just hang out there. So allow the muscle to release, allow it to sink, yourself to sink a little bit deeper, both into the stretch, and just rock back and forth there. Now this is an awkward position. If you do have true hip issues, this is probably gonna be difficult for you. So let me show you another way to get at it. So obviously not everybody is going to be able to get into that position to do that foam roll exercise, to get into the adductors. What you can do instead is just literally use your hands, or maybe a tennis ball or a runner stick if you've got one, and just work out the inner part of your thigh here. Just doing compression. All I'm doing is squeezing it, you know, taking the time to get into that muscle all the way down, both at the knee and continuing on up into the hip. To stretch this muscle now, or group of muscles, you're going to just lie onto your back. So come to your back, or in a modified position if you can't get all the way to your back. Bend your knees up to where you're able to bend your knees up to. If your hip mobility isn't that great, you might not be able to even bring them this far. But from here, all you're going to do is allow your knees to drop out slowly until you feel a stretch through the inner thigh. Now my hip mobility is decent. It's not great, but it's decent. So this is a pretty exaggerated example of how you're going to do this if you're having hip issues. So you might only be right here and feeling a stretch, and that's okay. Just pause there, hold it for maybe a couple of minutes, and you'll notice day by day, as you continue to do this, you're going to be able to notice that your knees are going to be able to get out further and further and further, as long as you continue to keep up with these stretches on your own. So now that we've looked at how to both stretch and release the muscles of the inner thigh here, let's look at how we're going to stretch the glutes out. One of the most common ways to stretch this is a figure 4 position. You can do this seated, semi-reclined, or lying down. I'm going to show you first lying down here. So again, if you can get onto your back all the way flat, that is the best way to do it, okay? So if you're all the way down in a flat position, fine. If you need to do it in a modified position here, fine also. So what you're going to do from here is bring your foot of the affected side, so we're pretending my hip on this side is affected right now. Take your foot, place it up onto your opposite knee, so you're forming this figure 4 position here, okay? If you're able, creep your opposite leg up closer and closer to have your foot almost meet your buns, okay? This is going to bring your right leg, this affected leg here, up higher and deeper into the stretch. Now, obviously, again, not everybody is going to be able to achieve this position. So even if you're just starting off with the leg straight and maybe your foot down at the shin, bending the leg up slightly, that might be enough for some people. Really, really easy, really simple thing to do, figure 4 stretch. You might not be at that level. Let me show you how to do it in a seated position. All right, guys, so here we are, just seated in a regular chair. To get the same stretch that I just showed you in a seated position, all you're going to do is, again, attempt to cross your leg. If you're not able to bring your foot all the way up past your knee, that's okay. Maybe it has to be a little bit lower, and that's fine. You can still achieve this stretch no matter what your level is, okay? If you need to take maybe your pant leg and pull it on up there, that's okay. So basically all you're gonna do, sit towards the edge of the chair, nice and tall, bring your chest towards the sky, and you should feel that stretch almost immediately back through that glute muscle. So all I'm doing again here, so you can see from the side. So in a flex position, we're not going to get a very good stretch. It's really important to be kind of towards the front of the chair and in an upright position. So as soon as you get yourself into the position, try and bring your chest up, creating a little bit of a anterior tilt in the hips and getting that stretch back here in the glutes. So now that we've gotten the tissue nice and stretched out and warmed up, it's important then to go back and strengthen the correct muscles, all right? So again, specifically, we're working the glutes and the piriformis here. One of the most simple things you can do is buy a band. Go get one of these bands. Again, you can just find them on Amazon, online, whatever. All it is a little bit of tubing, a little bit of elasticity here to provide some resistance so that you can strengthen through these exercises. One of the first things we have people do in the clinic is just try and do a bent knee fall out. So what is that? All you're doing is keeping a little bit of distance here between the knees while you're keeping one leg steady. One leg stays steady while the other leg tries to pull away. So as we're doing this, we're working both the leg that is moving and the leg that is stationary. To work this leg, I want to do both sides stationary. So again, we're going to keep this leg stationary now and move the opposite leg in and out, trying to keep this leg as still as possible. Okay, so this is going to be a next level up from what we just did. Again, we have the band here. Maybe you need to do it without the band to start, and that's fine. So basically, we're in the same type of position here, and we're just going to now try and bring this top knee out away from the bottom knee, keeping the hip tilted forward. So it's a small, small motion. You're not trying to bring it way back, right? So a lot of times what we see is when people have a lot of weakness in this glute, they're not able to do the small motion without twisting the whole torso to get that knee up in the air. And if that's you, that's okay. You want to start small, even if it's just that little bit of a lift off, and bringing the knees back together. All right, so the next level from that, actually working the glute medius now. We're working it a little bit different here. Instead of just moving at the knee, you're going to keep the knees pinned together and just lift up at the foot. So now we're working internal rotation, which has helped to strengthening that glute. Again, usually this one isn't as big of an issue for people, but incorporate this into your hip routine as well in case you do have some weakness through there. Okay, step 3 of the clamshell series. These are clamshells we're doing, by the way. So step 3 here would then just to be lifting the knee up. Okay, so heels are still together momentarily. Then we're going to add lifting the foot up, put the foot back down, bring the knees back together. So we're keeping the hip, again, turned towards the front of the mat or table or bed or whatever it is you're laying on. Raise the knee up, raise the foot up, put the foot down, put the knee down. So it's a few steps here, but you're making sure you're hitting all points of the glute in this one. Okay, again, if you're joining me from the knee video, we're back to that straight leg raise, laying on your side. So you should already know how to do that one if you're coming from there. In case you're not, though, you want to make sure, again, you're keeping the hip forward while you lift the leg up. A lot of times, again, you see people turn their hip up and trying to perform a sideline leg raise like this. That's wrong. So you want to make sure you stay turned towards your side, legs slightly extended behind you, and lifting the heel. Think about lifting the heel towards the ceiling. Now guys, I know that these exercises might seem really, really basic, but that is what it takes to get the hip specifically identified to strengthen these muscles. Again, I work with athletes that are big and strong, and they're barely able to perform these muscles. So the first thing you want to do, if you got the knee or the ankle issue, work at the glute. Do these exercises. You can change the level of resistance. If it's too easy, too hard, you can change that out. One last thing before we go, we're going to look at a couple of standing exercises. Again, anybody can do at any level. All right, guys, so last exercises here in this series for the hip. The very first one you're going to do, kind of check out to see where you're at level-wise, is trying to stand on one leg. You should be able to do this fully upright without any movement at the hip, okay? So I have this foam roll here just to stabilize myself, or you could use a countertop or anything like that, but you want to try and make sure that you're able to do this without the hip dipping one way or the other. Hold that for about 30 seconds. When you're able to achieve that, maybe we can work on some other things. So if you're able to do that single leg stand for 30 seconds, you're going to move on to a little bit of motion with it. So again, you're going to get on that one leg, making sure that you're not tipping one way or the other, and do a little bit of a bend, reaching forward and back. So you're just doing a little reach forward, small bend in the knee, and back. Last exercise to do here is a squat. So you might be thinking, well, I can't do a squat. That's okay. You can do it with a chair. One of our main functions all throughout our lives until we're 100 years old is to be able to stand back up out of a chair. So this is a really great exercise to do no matter what level you're at. If you're beyond this, skip the chair. But basically, you want to just make sure your knees are staying aligned, again, with the toes, and you're not caving in as you go to bend at the knee. If you can't make it all the way to the chair, we're just doing a modified position, modified squat here. If you're able to make it all the way to the chair, you're going to try and get all the way down, just tap, and come back up again. So I'm just doing a little bit of a tap at the chair and standing back up again. The further you're going to get into this motion, the more strength you're building in your glutes. All right, guys, well, that does it for our glute series, Treat Your Own Hip, as well as the knee and the ankle. I hope you enjoyed this video. If you did, make sure you hit that like and subscribe. I'll catch you on the next video. Make sure you're treating yourself well.